talk about, this is one of your like requirements in terms of,
Customer service.
yeah, in terms of CEUs, okay, you need 48, as you need 48 within two years. Customer service, you gotta have at least one of these a year. So you need 2 hours of this in a 2-hour period. So this is why you're here, right? So even scripts will ask you, hey, do you guys have a process of completing your customer service? How do I know if I send our patients over there, you guys provide good or great customer service? And so this is my job to provide everybody a way to provide customer service to our residents, okay? Now, customer service really, you can give good customer service just based on communication, right? Understanding your patient, right? And then just communicating the right way, okay? So patient and family members. It's important to include all members of the patient, right? Creating that good comfort zone between you, not only you and the resident, but you and the family members as well, okay? And I just kind of want to give a good example for a second, because in the West Hall, we have 2 patients that are actively transitioning. One of them is transitioning because I want to use the right phrase when talking about patient who is transitioning or actively dying, okay? A patient who's transitioning is a patient who's not exhibiting symptoms of like, actively dying stages, right? If you're actively dying, your breathing is changed strokes, you have mottled extremities, indicating that, death is near within the next 72 hours, right? But if somebody's transitioning, that means like, I think you believe it's 7B, forget what I'm doing, don't say the name. But the patient is still talking, he's got good vitals, she's still drinking a little bit, okay? So this patient is preparing to get into the stage of actively dying, right? But we're keeping her comfortable, and she's still verbal, and you still able to get her blood pressure. In this stage, and the patient says, stop eating, basically, stop eating and drinking. You're gonna say that this patient is transitioning, right? So when I visited this patient today, there's family members in that. When you're taking care of this patient, you wanna, obviously, when you come into the room, you wanna greet the family member along with the patient, right? When you're taking care of the patient and you want to provide care for this patient, you want to ask the family member what is the best way to take care of this resident. So including family members on how to take care of these residents is going to be part of your customer service, because they feel like, hey, I'm being included, and I'm being, they're aware that I'm here, and they're asking me what I feel like should be done for my loved ones, right? So creating comfort zone between you and patient and family may provide significant, kind of like a security blanket later on, right? So just for example, you make a mistake for whatever reason, right? And the resident is not complaining, hey, what Dawn today was, she didn't take care of me in the right way, right? And this patient could be confused, right? She didn't pick up a call light. She didn't take me to the dining room. She didn't do any of that, right? And she could call her family member, and the family member, if they know you and you guys have created these boundaries, this comfort zone where you communicate with family, and you know who they are, they know who you are. They're not gonna quickly jump into the scenario where, okay, yeah, Dom didn't provide care for my mom, right? They might even take her back and be like, hey, mom, are you sure? Because we know Dom, she's great. You know what I mean? And so, but that communication between you and the family member, and then explaining to the family members that this patient's confused now, is going to save you later on too, okay? So it's really important to get into the side of the family and then communicating with them in the right manner, right? Also on this, in this situation here, body language and facial expression and the tone of voice is really important when you're doing communication with not only your coworker, but your resident and family member as well, okay? So that, even when Dawn was over here joking around, right? With Rachel, right? So the tone of voice, we don't know if she was joking around, but I don't know Dawn, she's joking around. And, but I can tell that Rachel, based on her body language, she's like a tiger, man. I'm gonna jump over this. I gotta go get my hey, I gotta tie my hair back, you know, it's about to go down here.
Girl, uncle, get your blonde
Yeah.
ponytail.
So I'm about to turn this video around.
Yeah.
We're about to go
Are
viral.
you recording it now?
Yes.
Oh, okay.
So, okay. Do you need to fix your hair or anything?
No,
Maybe
I'm
take a
fine.
break.
No.
There's a bathroom over here to fix your hair. Your hair looks fantastic, by the way. Looks
Thank
good.
you.
Yeah, yeah. So you don't need to be
I like
fixing
it. You
I like
it?
So, okay, so avoid being rude and arrogant, communicate to personal level with your patient. Okay, so that's really important to communication. Again, customer service is going to be based on how you communicate with your residents. Residents may prefer communicating their needs if they are feeling depressed or lonely. If you don't have that good relationship with a resident, if they're feeling bad that day, if they have an infection and they're feeling like lousy that day, they might not even tell you, right?
Yeah.
So, but if they're comfortable with you because you connect in a different way and you provide good customer service, that resident's gonna tell you right away, hey, I don't feel good today. And then right then and there, before you even take them to the dining room, you can say, hey, you know what, she's not feeling good. I think I'm gonna keep her in her room. Let's not take her to the dining room. Let's go and keep our vitals checked. You know, let's do these labs, right? You can get on this right away, right? You have the, you can get that information faster. By treating resident with dignity and respect, you can gain their trust. Okay, so that's how to gain their trust is really by treating them with dignity and respect. With trust, communication between you and your residents are smoother. Residents may have hearing or vision impairments. Communication between you and your resident is important. Okay, so if you know your resident and you know they have visual impairment or they might even have hearing impairment, you as a nurse, as a CNA, are gonna have to accommodate that, right? So if somebody has hearing impairment, you're gonna have to pick out which ear is better to speak on, or do I need to be closer, right? Should you be yelling and screaming? No, you shouldn't be yelling and screaming, but you should probably increase your voice, right? And that eye contact is gonna be really important when somebody's deaf and has hearing impaired. That visual, because the resident's gonna read your lips, your body language, right? So that's really important to kind of sit down, eye level with the resident when you're communicating. Now, if somebody has visual impairment, the communication between your resident is a little bit different as well, right? You might have to use touch, you might have to use more of your verbal type of communication, right? And telling them, hey, certain things are in this area, or it's at 5 o'clock, or at 2 o'clock, or at 12 o'clock, right? So those things are you're gonna have to be very creative in communicating with your resident. Once they kind of gain your trust and they know that you know how to communicate with them, it's gonna be a lot easier for you, right? But knowing your residents and their weaknesses and their strength is gonna be really important. Okay. Remember that residents with dementia may not necessarily remember specific short-term events, however, emotions from such events can linger for incoming shifts. So if you come in on the PM shift and that patient had an encounter with an AM shift CNA where she didn't want to take a shower and she's upset, right? And she's probably going to be upset for the whole shift. So you might not even know the reason why she's upset. But when you come in on your PM shift, you're going to have an angry, agitated resident. And you don't know why, right? And it may have been that she was having pain in the morning, was constipated, but she can't even tell you, right? Or a CNA triggered her because she didn't want to take a shower, and she was kind of coaxed to go over there to take a shower that was, that she didn't want, right? So just kind of remember that residents have dementia, Alzheimer's. They're gonna have lingering behaviors and feelings of anger, anxiety, but they're not gonna be able to tell you the reasons why. Okay. Allowing residents to talk, express themselves, and providing good listening skills is a great communication skills, right? Listen to your resident just as you would as your husbands or your wives, right? Providing good listening skills.
I don't know about husbands.
Yeah. Boyfriends or whatever it is you might have.
Whatever you have at home.
Side dudes and side. I don't know what it is. Yeah. So allow people to talk and then listen to them. Listen to their problems. Greeting your coworker and visitor with a smile and simple hello will create a positive impact in our unit. So the importance of saying hello, or smiling, or just talking and greeting your coworker. Those are really important kind of start off our day. Remember that we all go through different struggles, and although we may smile at work, some of us carry a heavy load at work. As a simple gesture from our coworker may lighten that heavy load. Okay, so you don't know. Like I come here smiling all the time. You know, I could be struggling at home, right? My kids could be beating me up. My wife could be, strangling me. Have all this bruising and stuff like that. You don't know that, right? I come to work, I'm happy, right? So you guys are gonna have to kind of like, hey John, how you doing? Everything good? Yeah.
Everything's good.
Right? We know how to hide stuff, right?
That is for
So
sure.
yeah, I get abused at home all the time. I don't tell you that.
Stop it. Oh
Yeah,
my goodness.
See that? So, but we don't know what people go through so many stuff, and they're really good at hiding stuff, right? And so for those of us who don't know how to hide stuff, we know who these people are. They come to work agitated and angry all the time, right? So,
Or a fake smile.
but most people are really good at like hiding things, right? Because that's how you adapt, right? That's how you are able to take care of your family. Like, can you imagine if you're able to like bring your anger from home to work? We won't be able to get anything done. I mean, man, shoot, right? Right, Sylvia, you want to talk about this?
You're recording this one.
So, yeah, we gotta be supportive of one another and know that every one of us is going through struggles, and a little help here and there is gonna make a ton of difference later on. Okay? A toxic environment can lead to frustrations and less efficiency at work, but more importantly, it can lead to stress, arguments with your coworker. Okay? Remember, you can have 10 people in a room, everybody's positive, but one person is negative. You can have the whole room be negative in an instant, right? So let's kind of help each other out. Okay? And then I think we've talked about this before. Did you know that if you work 40 hours a week full time, or 8 hours a shift, you'll spend approximately 160 hours a month, or 1,920 hours a year, or 80 days of the year. This is how much you'll be spending at work. This will be a tough environment to be in if you don't get along with your coworker. So in 1 year, if you're full time, 5 days a week, that's 1,920 hours. That's 80 days a year out of the 365 or whatever, right? That's a long time to be spending time with your coworker. Right? So it's important to kind of get along with your coworkers. Yeah?
Thank God we don't have that problem
Yeah.
here.
You're gonna be here anyway, right? You might as well make it a positive,
Right.
right? And then for your resident, who you're taking care on a daily basis, you're gonna have to find a way to make that resident happy and meet their needs. Okay? So a simple hi or smile, or how can I help you, separates the best from worst in skilled nursing. Treating everyone with respect and acknowledging their presence is one of the best ways to improve customer service. Okay? And then over here, I kind of go over about how to, and we know how to determine whether somebody is oriented or not. And we talked about this so many times, but for our new CNAs out there that kind of are from the outside looking in, how do we know patients are oriented or not when they're first admitted in? We make simple, how do we know, Don, what kind of conversation do we make for a resident who are coming in, and you may not know they're oriented times 4, right?
Right.
How would you know? What kind of conversation would be?
I would
making with the
ask,
resident?
I would tell them what my name is, introduce myself.
Yeah.
Just see if what their,
What the response is.
the response is, and
Yeah.
then,
That way they're.
ask them if they know where they're at.
Mhm.
How about the date? The
The
date?
date,
the
and
date,
if
yeah.
they know that they're in a facility, I'll just,
Yeah.
there's.
Yeah, what does it say?
Who the president
Who the
is.
president is,
Yeah.
right?
That's a good one too,
Right,
yeah.
so
Yeah.
what is the 4 things that we're looking at? Person,
Name,
name,
person, place,
Person.
date,
Time.
is it time?
No.
No.
yeah, person,
'Cause they
time,
would-
place, and situation.
Yeah.
Okay, so person, like you can say, just like as she would be
Place.
asking, right? Person
Situation.
and situation. Like, if, for example, why do you know why you're here? Like, oh, why are you here? Did you?
Okay.
Like, if they say, hey, I'm here because I'm on vacation. I'm on vacation.
Oh,
They're not
they're not.
wanting to, right? If they here because they say, hey, you know what, I broke my hip.
At the hospital.
Yeah.
Said he was like, why do they keep asking you why I'm here?
Yeah.
Trying to see how alert you are.
Yeah.
They should
Right.
know.
If you say, I don't know why I'm here, I don't know what the hell they're bringing me here for, I should be at home or something like that, right? I'm confused, right?
Yeah.
They don't know what's going on. But if they say, hey, exactly, I'm here because I broke my hip,
Right.
they're oriented. And that's 1 already, right? They know the president, that's person, that's 2, right? Do you know what time it is, like, or what month it is, right? This is time, right? And then
But
place,
they
where
don't
are you?
have
Where do you
access
feel
time
like,
for.
yeah. If you ask them, where are you at? Where do you think you're at? Right? What's the name of this place that you're in? Right? Just say, yeah, well, I'm here in skilled nursing. They might not know Seacrest, but they know that they're here for rehab, right?
For rehab.
Hi, I went from the hospital
That's what
here.
they usually
somewhere
say, I'm here
yeah,
for rehab.
yeah. That's totally fine. But they say, hey, I think I'm here in Bahamas. Is this Bahamas or something? I'm not home, right? They're not oriented, right?
Okay.
So your customer service, how do you use this for customer service? This is gonna determine how you communicate with this resident, right? If you know their orientation, it's gonna tell you, this is how I will communicate with this resident. She's obviously confused, so I'm gonna do as much as I can for her, right? I'm gonna engage her, but I'm gonna take the lead. If she's oriented, you're not gonna take the lead anyway. You're gonna be asking that resident, what can I do for you? How would you like to get this done? Can I do this for you, right? So that's really important. How to manage provide care for confused resident orientation. I just kind of told you, treat with respect, avoid talking on your phone. Level of care remains the same. Orientation 3 to 4. Yeah, somebody who's disoriented, confused, you're gonna take the lead for the resident. Yeah, obviously treat them with dignity and respect, but you know, you're not gonna allow the resident who's confused to kind of say, oh, okay, I'm not gonna do this, I'm not gonna do that. You allow them to make make a choice at a certain extent because they're confused, right? If they're gonna tell you that I'm gonna walk around outside, it's raining, of course not, you're gonna say no, right? So take the lead for these residents, they're oriented, make sure you are asking questions, okay? Any questions on customer service? Customer service. Alright, so these questions here. What are the 4 levels of orientation? We talked about that.
Person, place, time, and situation.
That's right, yeah. And then examples of questions for determining the orientation?
Do you know where you're at?
Or person, do you know your name? If you say person,
Yeah,
what
person,
are we asking?
like the
What is your
president.
name?
Who's the president right now?
But it says
That's easy,
person.
right?
Do you know who the
Yeah,
who is
that's
the
person.
president? Yeah.
So, like, they're not gonna know you when you come in. You can tell them your
Right.
name, well, for example, you tell them your name, my name is Rosalinda. 5 minutes later, you say, do you remember? Do you remember what I told
That's
you?
a hard name to remember.
That might, but if you ask them the most common name,
Do
who
you
is the
know your
current
name?
president, right?
But person, isn't it
That's person.
in regards to them? Like, what is your name? Oh, person.
Any person.
Okay.
Are they familiar with any person? If their loved ones come in, if you, say, do you know who that is? And if they say that's my son, or that, oh, that's, who, I don't know who that is, or that's who, if they say that's my cousin, sometimes they're confused and that's my cousin, even though that's their son, or whatever, that's their dad, sometimes, you've seen this before, right? That's my dad, or something, right? And they're clearly like 90 and their son is 60, and they're still saying that's my dad, because they look like them when they were, you know, their son looks like their dad when they were young, right? I've seen that before, like, that's my dad, or something like that, right? So, that's definitely a confusion, right? What's the other one? Time, we talked about time,
Who is the president?
yeah,
Do you know time and date?
yeah, what's today,
President.
what's today's month? Today's month, right? I
Do
think
you
it
know
closed,
why
I
you're
think today's
here?
March, it would be March right now, February right now, right?
Do you know why you're here?
Yeah, do you know why you're here,
Do you know
right?
your-
And some of them are confused, I don't know what you're talking about, I don't know why I'm here, I don't even know where I'm at. Where am I? Okay? So, can somebody be, and they can be confused now because of the medication, that's totally fine to say she's confused now, or disoriented, she's oriented times 2 or 3. Tomorrow she could oriented times 4 because all the narcotics has gone away. Or maybe the confusion is gone away because that infection has been resolved. So now they're, instead of oriented times 2, they're oriented times 4. That's totally fine, right? So you can do that on a day-to-day basis. Alright, resident who's feeling isolated or depressed may not report pain or feelings of depression.
True.
Right, that's true.
true.
Some residents who does not adjust well to new environment, new admins, may feel abandoned and or anxious.
True.
That's true also. Treating residents with dignity and respect is one way to build trust.
True.
Allowing residents to talk, having empathy and understanding is a good way to communicate with
True.
residents. And then identify the best ways to communicate with residents who has hearing impairment.
What
I
do you
put C.
Okay.
All of the above.
Gestures, repeat, speak
So
slowly,
this
identify
ways to
yourself.
communicate with patient who has vision impairment. Position yourself where the resident can see you best. Identify yourself by name. If resident has glasses, make sure that he or she has them on.
So it's only vision impairment,
B.
so it's B.
B.
Yeah.
But you can also do touch too, but yeah, B would be the.
Also position yourself for the
Wouldn't it
resident
be
to see
D?
the best. It
There's
should
no
be,
ways to communicate.
yeah, it should be D. all the above.
Yeah. Yeah, this
We
is-
don't have a D.
We don't have any, we don't
Yeah,
have
yeah,
all.
so all of these are pretty good answers, guys, so I would
So we
circle
just
all of
circle
them.
all of them? All of them.
Well, I don't know who made this test.
Wasn't
True.
it you?
That's what
But
we
look,
need.
look, it says patient who has vision impairment, and then A is position yourself where the resident can see you. So if it has vision impairment, it wouldn't be A at all.
Who has vision impairment?
Not, it's not stating they're blind, it's just
Yeah,
vision, they can't
impairment,
see
yeah,
you
they
that
can't see,
well.
so they can be like
So,
eye
okay,
level.
position,
Yeah,
okay.
They can see
Got
you.
you.
And that way you
from the
can
corner
get
of the
yourself
eye.
really close to them.
Yes, but yeah, vision impairment means, yeah, they're not like even blind. It just
Okay.
means that like it's kind of fuzzy. Okay, 7, showing compassion and concern can help deter isolation from you and
True.
residents.
True.
Most residents who want to socialize, as this is a way for them to ease their loneliness.
True.
Name ways to greet family the correct ways.
Are you
Just
warmly
put-
and
I
politely?
put
It's
A.
E.
Speak to them about how their loved one is
It's
doing.
all- it's all like
share
a-
your observations with
I
them.
just put
Okay, yeah, D.
A. D?
Yeah,
All of above?
yeah.
I say E.
Yeah,
I
I'm not
say
sure
E
what
too.
E is
There's
not.
nothing on E.
True or false?
There's
Questions.
no E.
Questions you can't answer from family members should be referred to your
True.
supervisor.
True.
What and how should I report to family about their loved ones?
Circle all the parts. A,
Eating well,
B,
attending
C.
activities, mood changes or no mood
D.
changes, active or non-active, how residents look care.
Just A and B.
I got A and
How
C.
residents look,
C?
active or non-active.
Well, that's usually
Like
the
you said
nurses.
before,
That's usually the
yeah, but if they
nurses'
come up and say, well,
area.
how's my mom doing today?
Well, she's eating well.
She's doing
It says
good.
circle
They say
all
she's
that
eating
applies.
well,
Right.
or she's attending activities,
So
but
A,
I don't
B,
know
and
about
C.
C.
Yeah,
A, B,
I would,
C,
yeah,
D.
I would, you know what, I would probably just circle all of them.
Really?
Yes. Eating well, attending activities, mood changes or no mood changes,
I
active or
was,
non-active.
if they ask me,
non-resident.
how's your mood, I'll go, well, go speak to the nurse.
That's true too, but like, it,
That's
you can also
isn't
say
it?
that she's been feeling really good today compared to yesterday because you have
Right.
more,
I said
you have
mood.
more vision on this
Oh,
resident, right, than
okay.
any
Right.
nurse would ever be, right? And it's like, oh, she's smiling more today, then I can hear that, right? So I always tell, CNAs, and this is more or less like for nurses, but like a good report for family members is like how they're doing physically, if they're eating, if they're attending their activities, and then just like their sight, right? How they look and feel. You know, maybe they're more awake today, maybe they're, you know, they're conversing more today than
So
yesterday.
A, B, and C.
So I would circle everything, Alex. I mean,
Everything?
any kind of conversation, any
Active
positive
or
conversation
non-active.
with families would be a good one, right?
Okay.
True or false? I simple hello or smile at family members.
True.
True.
Right. Okay, good. All right, any questions about anything?